Good afternoon, everyone. Thank you for taking time to join this meeting today. It's very nice to meet you here. And my name is Xingsheng Ren from Department of Pathology at Northwestern University. And today I'm going to talk about the project that I'm working on right now, which is how the cells behave in the inflamed intestines. So first, I want to introduce you the functions of our intestines and how they work, and probably some audiences have already known about it. So firstly, our intestines could absorb most of the nutrients from what we eat and what we drink. And secondly, they can absorb the water from the wastes and create the stores. So what will happen if they don't work normally? So first of all, before that, I want to introduce you the disease model that I'm working on right now. It's called IBD, Inflammatory Bowel Disease. And from these pictures, we can see that we found the first cases in the Western country in 1859. And then the cases keep increasing, and then we found another new cases in the newly industrial countries in China in 1956, and the cases still going up. And also from the data in Center for Disease Control and Prevention website, that they report that in 2015, there's already 3 million people have been diagnosed with IBD, and which reflect the burden of IBD in the US. So if the patient have the IBD, then many of them, they will have these symptoms, so such as fevers and vomiting, kidney stones, and skin disorder, joint pain, the rectal blood, and then abdominal pain, and the inflammation of the eyes. So from here, we can see that it almost impacts all the functions of all the organs in the body. And also, if the patients keep having the IBD without correct treatment, then it will become worse, and they will cause colon cancer, all these long-term complications of inflammatory bowel disease. And also, cancer, I think everyone knows cancer. People don't know cancer because it may kill people. So, and all of these symptoms are because of the dysfunctional intestines. And from these pictures by endoscopy, we can see that they are the common looks of the inflamed intestines in IBD patients. And we can see that the inflamed colon, they look red and swollen. If the patient have IBD, they feel painful when they get this. And also, the main cause of the inflamed intestines, and because of our immune system, they respond incorrectly to the environmental triggers, such as the virus or bacteria. And then, if we look at the tissue and the microscope by staining with some dye to visualize the cells in the intestines, we can see that there's a lot of cells infiltration into the lumen when they have the IBD, inflammation. And then we call these cells neutrophils. And also, neutrophils is one type of the immune cell. They are formed from the bone marrow, stem cell in the bone marrow, and they are short-lived and highly mobile. And they can enter parts of the tissue. And where the other cells or molecules cannot. And also, they are normally found in the bloodstream. And during the beginning phase of the inflammation, particularly as a result of the bacterial infection, and where they are one of the first responders of inflammatory cells which migrate into the site of the inflammation, and where they can destroy the microorganisms by ingesting them, and they can also release some enzymes that kill them. So many researchers also found that the neutrophils have gene heterogeneity. And from these pictures I showed here, they are all neutrophils, but they expressed different levels of different proteins. So which make them have different functions. And so from this previous slide, we can know that during the IBD in the inflamed intestines, there will be a lot of neutrophil infiltrated into the site of the inflammation. So my work for now is trying to identify what type of neutrophil that can migrate into the intestines. So my strategy for now is that, so firstly, we use an imaging system, then we can find out what special protein they could extract, the intestinal neutrophils could express. And then we will digest the tissue and make them into a single cell suspension. And then we will use also special antibodies, for example, the ICAM1. This is a protein that could express on the intestinal neutrophils. And then we will use a special antibody, ICAM1 antibody, which means this antibody can only bind to ICAM1. And also we will label with this antibody with different fluorescence marker. And then we use a machine called flow sorting machine, and this machine can recognize and read the fluorescence, so they can separate this ICAM1 positive neutrophils and sort them out to further study the functions of ICAM1 neutrophils, positive neutrophils. So, like, if this population is very important, so first we will try to target this positive neutrophils. Of course, they are in the intestine, inflamed intestine, and we will target them with the antibodies or the drugs, and to see how important they are, how can they help us to treat IBD. So that's my work.